all want our kids to be active, but we know sometimes active children can get injured either from playing sports or maybe just playing with their friends. Dr. John Kemppainen is a pediatric orthopedic specialist at Helen DeVos Children's Hospital. Thanks so much for joining us here today. So tell us about the difference. Why do we need pediatric versus adult orthopedic specialists?
Well, the major difference between kids and adults is fairly obvious, that they're still growing, but their growth plates are still open, and treating and managing orthopedic injuries and conditions in kids who are still growing can be fairly complex, and there are some inherent differences in treating children versus adults who are done growing and don't have open growth plates. Yeah,
well, and especially, I mean, even through that threshold of, you know, going from pre-adolescence to adolescent to maybe you've got adult-sized teenagers who are still growing too. You really have to have expertise in a lot of different areas when it comes to treating these kids.
That's exactly right, yeah.
Okay, so we talk about the different kinds of conditions. What all do you see? What different kinds of injuries do you see?
So as a pediatric orthopedic surgeon, we see a wide range of conditions, from simple fractures and sprains to sports injuries to more complex deformities like scoliosis or club feet in babies or older people. So it's a fairly broad orthopedic practice within the age group from birth all the way up to 18 years old.
And some of it may be chronic, ongoing set of issues that a child may face because of something that's happened with birth, and then other things are just more acute.
Yep, absolutely. We have many patients that we treat from birth until adulthood, but then we have others that we treat for just a few weeks or a few days for an acute injury.
And some things maybe aren't evident in the beginning. Something like scoliosis is something that maybe you will notice or will be detected in your child.
Exactly, that's exactly right. A lot of things that we treat are not detected until kids are a little bit older, and usually are picked up by the pediatrician and referred to us.
Okay, so what would we do if our child is injured? Are there certain steps that we should take, especially if it involves something that would require the assistance of a pediatric specialist?
Yeah, I mean, I think the biggest thing to keep in mind if your child is injured is that it can be a scary time for both the parent and the child. And so the biggest thing is to just try to stay calm and keep the child calm. You want to first take a look at the arm or leg, and if you notice a severe injury such as a bone sticking out or a deformity or the bone looks crooked, try to make a splint out of something simple at home, either a big beach towel wrapped around the arm or even just something as simple as a stiff cardboard box. And then if it is a severe injury like that, you should probably go straight to the ER. If it's less significant, then touching base with your pediatrician, or even coming to our fracture clinic would be an option.
So tell us about the fracture clinic. I think this is really awesome because you offer these opportunities for people without an appointment to come in and see you.
Yeah, so we have a fracture clinic from Monday through Friday from 7 to 8 a.m. It's a walk-in clinic. You don't need a referral from either your pediatrician or the ER. And it's designed for acute injuries. So patients that have been injured, parents maybe think they have a broken bone or some other issue that needs orthopedic care. We have x-rays on site. We can do casts, splints, anything that's needed at that point. And if for some reason it needs surgery or a reduction, a bone needs to be set, then we can arrange that to be done as well.
And for most parents, do you think that they find that reassuring that they at least would get a timeline of, okay, my child was injured, but we do have a strategy and a timeline for when they will get better?
Yes, absolutely. And the nice thing to keep in mind, and it helps the parents and the patient keep calm, is that the vast majority of injuries in children heal fine, and the kids don't have any problems long term.
And if people are interested in connecting with you, I know you do have services available at different locations.
Yes, that's right. We have locations in our main location here in Grand Rapids at 35 Michigan. We also have a full-time clinic in Traverse City with Dr. Mike Fornes up there. And then we have monthly clinics in St. Joseph and Lansing as well.
And so if somebody's interested in maybe getting some more information or connecting with you, can they just reach out directly and maybe you'll direct them to where they need to go?
Yes, that's right. Yep, if somebody is in an outlying area, if they call that main number you can see on the screen there, they will be able to help direct them to the appropriate clinic.
Fantastic. 616-267 and the rest of the number on
2600.
2600.
Yep.
Thanks so much.
All right, thanks for having me, Terry.
And stay right there. More of 8WEST when we come back.
Are you well?